Hi, this is Jack Mabb, Public Health Director for Columbia County. I'd like to welcome you to a new school year, one that may well be the most challenging of your career. I also want to take a few minutes to speak to you regarding the plans that your superintendent and principals have put in place to keep you and your children you teach safe in the face of the COVID pandemic. These plans have been developed over the summer months through weekly virtual meetings with our department. In fact, we've been meeting weekly with school superintendents since March, when schools first closed down. While local health departments have not been charged with actual approval of these plans, our department, like our counterparts across the state, have been intimately involved because you and the children of the district are our constituents, and we are committed to doing all we can to keep everyone safe. We believe that the plan your district has put in place keeps those safety pledges. No one can know how the virus will play out once school starts. Judging from districts in other states that have already opened, we will have our challenges. We will very likely will have positive cases in the classrooms. I want you to know that your school nurses have met with the nurses heading our COVID response team and have discussed how students with potential COVID symptoms will be cared for. We have discussed how these students will be screened and how potential exposures for other students and faculty will be handled. Your nurse knows they can contact us anytime. Our department, like all local health departments across the state, has limited capacity to test for the virus, but we can test children and faculty whose medical providers believe they should be tested, and we can test those who may have been exposed, again, on their medical provider's assessment of their potential exposure. Tracking down those who may have had exposure is contact tracing, which I'm sure all of you have heard about. That is our job, and we will do it in conjunction with the nurses, teachers, and administration of the school. Individuals who've had an exposure will be contacted and followed by our department. Should there be a need to close down classes or portions of your school, we will, as we have all along through this crisis, work with your superintendent to make a decision that stays true to the pledge of keeping students and staff as safe as possible. Thank you for your time. Have a great school year.